don't we go ahead and get started? So essentially what we wanted to do here today with you all is we know that there are lots of different amounts of information out there, and many of you from where you sit have been involved to a greater or lesser degree to either strategic transformation and or the Family First Prevention Services Act. So we wanted to go ahead and just make sure that we had just a basic understanding across the board of the strategic transformation, the need for change, and then also the different pieces that we are putting into place to support the change. Next slide, please. So, one of the important things here is that when we think about strategic transformation, we think first about transforming our approach to keep more families and children together. And hopefully, that's something that all of you have heard just over and over again. It's something that I think we've all been driving towards as a system for a long time. What we wanted to make sure that people understand is that Family First Prevention Services Act is a subset of what we're trying to do in the child welfare strategic transformation, but it's not all of it. The federal government passing Family First really boosted our efforts, but our child welfare strategic transformation encompasses more than just the basic requirements of the federal law. So, as we get started, we wanted to throw out a polling question for the group. So, go ahead, John. So the question that we have for you all today is, what percent of child welfare cases do you think could be handled with an in-home safety plan? So the choices are up to 10%, 25%, or between 10 and 25%, 25 to 60%, 51 to 75%, or more than 75%. And so this is really just to get a sense of where we're at as a community. And we're doing this poll across our different groups that we're doing the town hall to kind of see where people are at. So go ahead and vote. And John, how are we doing on the voting?
Doing well. I'll give it another minute or so. We've got about 70% of the people voted so far.
Great.
Slowing down. All right, it looks like we have hit critical mass. So I'm going to end the poll and then I will share the results.
Okay. It looks like the greatest proportion of people, wow, by a long shot, think that it's either 51 to 75% or 76% and greater. So that's really helpful for us to know that, we're sort of preaching to the choir, right? So we all think that there's lots of families that can be served with an in-home safety plan. We do have about, just under 20% that think that it's less than 50%, but that means that nearly 80% of people think that it's more. So really helpful as a base setting. And when we think about our Wisconsin framework for child welfare, first of all, we think about all Wisconsin families being safe, loved members of thriving families and communities. And so where that situates the child welfare system specifically is strengthening all Wisconsin families to support their children because children belong with their families. There are several key priorities that we've been working on under that umbrella. So first and foremost, to strengthen communities and build services to support families in their home and to keep children in family settings whenever possible. So under that umbrella would be a lot of the work that we're looking at in terms of relatives and kinship care, to improve our group care system and, also to support our workforce with solutions and improvements. Next slide. So why make a change? One is that as a child welfare community, we understand trauma and attachment much better. We know that separation from primary caregivers can have long-term negative impacts. And we also know from our own Wisconsin data that 80% of removals are for neglect. And so as we dial back the root causes of neglect, really thinking about what could we do for those 80% of removals to try to avoid a removal in the first place. I think it's important for us to recognize that while there are still, gaps in the service continuum right now and families that all of us feel like are better served in out-of-home care, as we shift as a system and really build that community fabric, hopefully fewer and fewer of those removals would need to happen as we sort of increase the ability to be able to serve kids in the community. Next slide, please. So just a few more pieces of Wisconsin data for you. And I should just clarify that this is 2019 data. We know that 2020 data with COVID is going to be a little bit of a mess. And we've been spending a lot of time digging in and trying to figure some of those pieces out. But for the purpose of this presentation, we'll focus on 2019. So neglect is, and really always is, the primary type of screened-in maltreatment. It always sits somewhere right around that 60% mark, and that was the case then. Neglect, as I said earlier, is the primary type of maltreatment that's identified as the reason for removal. And this one I think is really important for us as we think about where are the points of intervention. Of the children who were removed during an IA who are subsequently reunified, 30% of them went back home within 30 days of placement. So when we think about the attachment and separation research, along with the fact that many of our kids, almost a third, are going home within 30 days of placement, I think that does give us a place to focus as a system on what could we be doing differently. Next slide. Family First Prevention Services Act has really helped codify what the research has been showing, and the direction it's been going for years, that children belong with their families. And Wisconsin will be developing a prevention plan to try to sort of outline what needs to happen under Family First. Next slide. It's impossible to talk about child welfare and removals without bringing in the issue of race and racial disproportionality. I think that if you talk to most people in the community, they would say that child welfare involvement is a rare and exceptional kind of a circumstance. But nationally, 53% of African American children will experience an initial assessment in their lifetime. That's a big number. That is, I think, way more than anybody would have ever expected. It's certainly more than I would have thought. In Wisconsin, we're no exception. So in the balance of state outside of Milwaukee, African American children were referred for suspected maltreatment at almost 3 times their proportion of the population. And those kinds of disproportionalities really feed through the system all the way to African American children being more likely than white children to age out of home care without permanency, which we know puts them at risk for adverse outcomes. I think that it's important here to note too that because we have significant racial disproportionalities in incarceration in Wisconsin, there's a link there too. We've got lots of kids who have families who are unable to parent them for a period of time due to incarceration, which again can lend itself to higher rates of removal. Next slide. But while disproportionality in child welfare has been our past, it doesn't need to be our future. We are looking at the very front door of the system to try to figure out how can we stem the tide of children of color entering our system in the first place. And I think that that's where we've really started to look as a system in terms of our safety assessment, safety planning. Is there anything in there that we think might disproportionately lend itself towards children of color entering our system? Next slide, please. So when we think about supporting families in the home, I think that sometimes it's really helpful to know that we are making tremendous strides. So I will explain this slide. So in 2015, this is the money that we spend and the number of families served in our flexible in-home services dollars, which are currently TSSF, Targeted Safety Support Funds. So from 2015 to 2020, you see a significant increase in the number of counties participating from 17 to 65, in the amount of money invested from 1.3 million up to nearly 5 million. And then, really importantly, in the number of children served. So from just over 200 to 2,400. So you can see that we have a very significant increase in the attention, the focus, the funding, the families that are being served in home. Next slide. So the Family First Act also changes the reimbursement of our Title IV federal funds. And at its base, Family First really is a change in how the federal government reimburses the state governments for their child welfare expenditures. There is a new piece of Family First, which will allow us to be able to be reimbursed for some front end services for children who are in home. And so that's where our prevention plan comes into play. Next slide, please. What we're working through right now on our prevention plan is really looking at building a cadre of services and supports that might be able to be both available and then claimable. So after a rigorous process with lots of stakeholders involved, we selected home builders as one of our well-supported parenting interventions. We're also looking to leverage the work that's already being done, the excellent work in Wisconsin on our home visiting programs, including Healthy Families America, Parents as Teachers, Nurse Family Partnership. And then also looking at the counties, when we have a handful of them who are using motivational interviewing to see whether some of that can be used in the front end of the system, and then we could generate some federal funds back for those. Next slide, please. We know that those evidence-based interventions are necessary, but very insufficient to serve families. So there's not going to be a circumstance where the only thing that a family needs to be able to stay at home with a child who we've determined as a system is unsafe is home builders, right? There's going to be other hard services and supports, things like childcare and housing and other pieces like that. And that's where we have a biennial budget act that request that really would help close that gap. Next slide, please. So when we think about the service model for in-home, one of the things that we have really heard from our stakeholders is that we need to be able to show all of the ancillary services and supports in our field that when a child is not removed, it's not just the absence of a removal, but we actually have a plan for that child and that family that really shows the services and supports that they need. And so when you think about a house that's typically situated within a community and that has different services and supports, we think about this integrated service model as having that sort of accelerator of the CPS professional who can really help make sure that connections are made, that we have those soft services and supports and those evidence-based practices to be able to leverage community resources and keep kids in their home. Next slide, please. We have a very intense focus right now on support for relatives and like kin providers. We're right now actively trying to understand what are the barriers to relative and like kin placement so that we can help both address those barriers and also address the racial disproportionality in those types of placements. Next slide. In the governor's budget, there's a really encouraging array of proposals for this particular area. And now would be the time for those of you who have not had the chance to reach out to your legislators and lend your support. Now would be the time. So there are $12 million in both the evidence-based prevention and those family support services. So what I like to think about is sort of the hard interventions, those evidence-based programs, and the soft interventions, which are not soft at all. They're things like housing and childcare and all the things that families need that would never be evidence-based. So $12 million as a state would really put us on a good stead to be able to start proliferating some of those services and supports for families. And then also there's some dollars for a new child welfare worker training program, $1.5 million to really get that up to speed and really think about what is it that our workforce needs now and how are we able to support those needs. There's a significant increase in kinship care, which would both raise the rate from $254 to $300 a day. And then also it would tie that to that foster care level 1 rate so that kinship care providers are not being paid less than foster care providers as they are right now. And then there's also some increases for age-based foster care at all levels. Next slide, please. So if we shift our attention for a second to the higher level of care, you all know that FFPSA has a lot of requirements on group care, which are all under that umbrella of the Qualified Residential Treatment Program Designation, or QRTP. Some of the pieces of that are access to nursing care 24/7, a trauma-informed treatment model, having to be accredited by a specified set of national accrediting bodies. So the state doesn't yet have the ability to implement the QRTP, and we will need to be able to do that to affect our federal 4E reimbursement. So I can dig into that a little bit more. Right now, the QRTP bill was passed this week by both houses. It is literally sitting on the governor's desk for signature, and we're hoping that that's going to happen very soon. And when that happens, we will then be able to start working on an emergency rule so that we can put together what are the requirements for these private agencies to become QRTPs. We are really trying to mimic the federal guidelines to make sure that our private provider community really understands what it takes to become a QRTP, and they're able to meet that bar. The QRTP designation will allow the state to continue to collect federal reimbursement on the children who are in the deep end residential care centers and group homes. For places that are not QRTPs, then after 14 days, we will not be able to get for a reimbursement. So that's sort of how that affects it. So it's not a child level visible change. There's not anything that's going to happen on October 1st. There will need to be a little bit of changes in the court process. And that's something that we're working on with the Children's Court Improvement Process, or specific court findings that have to be made also for a child to be in a place in a QRTP and to be reimbursable. So we will continue to communicate with you all on the next steps there. There's a lot of moving pieces, but we feel like we're in much better shape now, so that hopefully we can meet that bar as soon as possible after October. Next slide, please. And then, QRTP designation is really not going to be the solution to, for example, the youth that are going out into out-of-state placements. And it's impossible to have a conversation with any county across the state without this coming up. I know that it's causing a significant amount of stress throughout the state. And so we have been really trying to think about what is it that we can do to understand and to provide the right incentives for treatment, therapeutic treatment for children who are in those out-of-state congregate care facilities. We are working with a contractor on a new congregate care quality initiative. So lots of work happening in that field to make sure that while we're at the same time trying to serve as many children as possible in their homes with relatives and with kin, we also do have a framework that meets our needs for those short bursts of therapeutic treatment, always facing back towards the community. Next slide, please. Here again, there are some governor's budget initiatives for the residential care centers and group homes to be able to meet that 24/7 nursing requirement. There is a proposal for $400,000 to support a centralized nursing services contract so that each small provider wouldn't have to find their own nursing services and contracting. There's also some training that would be built into the budget proposals right now for quality services and supports for kids and youth to train group care providers. And then there's a Milwaukee-based state-supported QRTP that would serve high-needs youth statewide who may otherwise be sent out of state. Next slide, please. So the final prong of our work is really giving the child welfare workers the training, the tools, the infrastructure, and the support to be able to support their work. We know that without having the right sorts of tools for our workers and supervisors, we won't be able to execute either Family First or our child welfare transformation initiative. Next slide. So the three main pieces of this are, first of all, invest in improvements in training and technology. The key is to maximize time with families. So that's what we're looking at every turn, really trying to figure out where are the places that we can streamline aspects of the work using training and technology to be able to have that time in the field. Then also, the new worker training model, which we've already talked about, and some significantly enhanced infrastructure to support youth justice and youth services initiatives and increase cross-system collaboration. I think it's really important to note here that one of the reasons why DCF really wanted to have the state supervision of the youth justice system was to really think about those youth in combination, hand in glove with the youth who are in care because of our child welfare system. And so when we talk about all of this child welfare strategic transformation, we really are talking about child welfare and youth justice. We're talking about all the kids in our system who would benefit from being served in their homes and in their communities. Next slide, please. So again, here there's the money for the new worker training, and then some additional dollars, $500,000 for independent living expansion. You may or may not know that we actually have more restrictive rules in Wisconsin than in the federal law for who is eligible for independent living. In Wisconsin, we require that youth have to be able to age out, whereas that's not true for the federal law. And the reason we do that is because we have very, very limited dollars in Wisconsin for independent living. In most states, the federal money, which we get about $2 million, has a significant stateside match. We don't have that here. And so we're looking to the legislature for an infusion of $500,000, which would allow us to be able to support as a state both youth who were reunified before 18 and allow them to have access to independent living supports, and also move eligibility from 21 up until 23. We are also working on a no wrong door approach for youth services, and all of these pieces again. So as I'm talking about the budget, this is not a done deal. As many of you may have seen, joint finance will be starting back from the base budget. So these will hopefully be options for them to adopt. And again, now is the time if you see things in here that you think would be helpful for our system. Next slide, please, John. Okay, go ahead.
All right, so I want to talk a little bit about supporting the change, and we've had some communication about this, but really wanted to talk about, how we support this change, because typically we may think change is easy from our perspective at the state level, that when there's been big federal laws or state laws, we've, done the typical approach of send you guys a memo, information, support you with webinars and training. But we know that if we really want to do this transformation right, we had to take a different approach. And so we really thought hard about this and wanted to take this new approach to really help engage the heart of the organization, because we know people at our workforce level are the people that are going to make this change. But it's also a system change. We all have to support each other in this change. And so it's really important of how we engage a process that creates that positive change, and people see that and also see that we're in this together, that this change is important for us as a system. And so we have collaborated with Root Management and Casey Family Programs, who provided a lot of the funding for this, into a two-phase kind of change management approach that is really aimed at our workforce and how we support them in this change. So the phase one, which I sent you guys a couple of weeks ago, the results of that, which is really the research and insights into the behaviors that we want to see from a positive change from kind of a leadership, but external and internal support. And then the phase two, what I'll talk about in a second, is that engage and sustain. So how do we engage the workforce in a process where we can have conversations about this at the local level and how it fits into their organization? So again, we talked about that phase one and two approach. So that phase one approach, where we work with 13 counties that really help us understand what are the mindsets and behaviors that help keep children in home. And we learned a lot from that process. I think that it is applicable to all of us as we think about that. And we also understand how the different supports and services are offered and how they are used within our system. So our timeline, we completed that phase one approach in March of 2021, and we shared those results. We are right now in phase two of our process. So there's kind of two components of that, which is the Compass training model that kicks off next week that we sent out to you. We had a number of slots. That is really a people leadership training, interactive process. It's a cohort model that you'll go through. Either there's a 1 week model and then there's a 6 week model for 2 hours a week. But it's a very engaged process to help our people leaders really understand how to help lead this change within their organization and give them tools and feedback and conversations throughout this training process. And then the engagement process, which will start this summer. And we've talked about this. This is a process where we will work with each county. We will have facilitators assigned to your county that will work with you, and you'll go through in cohorts of 10 with your staff in a very facilitated 2-hour process where there's a film and then there's learning maps. So it's a picture of kind of where we're at today and where we want to go in the future with serving more families in home. And there's questions and interaction around that. So the facilitator's job is really to help that staff have those honest conversations about what it's like within your system and in your county, and how do we support this move going forward. And then there's a big piece of this too, is we know that change is just not a one-time shot, that we just don't do it and we're done. So how do we create that lasting change? So there'll be some tools bringing continuous feedback about that, some early adopter analysis, so understand people that are doing this, what have they done, how they've been successful. So it will be an ongoing engagement process as we go forward. And then some other good news is we also have heard from a lot of you, our colleagues out in the counties, that for you as directors and leaders within your county, it's really important too that you got to have those conversations with your key stakeholders in your local communities. So law enforcement, schools, your legal system, so your judges, DAs, court councils, and then your county boards, because they will be providing funding for this. So we are working right now with Casey Family Programs again that will provide some funding, and working with Root on a creative solution to give you guys some tools that you can have those conversations. It won't be exactly like this, so it won't be a learning maps and things like that, but we'll give you some tools and a consistent approach that you can use within your local communities to have those conversations. So stay tuned, there'll be more information coming out about that. We hope to do that later this summer. This is something that I definitely want to have county directors directly involved in helping us as part of that project team, because we're developing the solution for you. But we're very excited about the approach, because we've heard from many of you that this is really important for you to have that, and then to have that consistent approach throughout our state. So we really look forward to that in the near future. So Wendy, I'll turn it back over to you.
Great, thanks, John. So we really just want to thank you all. We have asked a lot of people, both in terms of joining us on lots of different work groups and thought work, and also to push the system to try to be the best that it can. Next slide, please. And so we're just really thankful to each of you and to our leaders, counties, the tribes, our providers. Lots of our partners at other state agencies have had to jump in and help, and obviously lots of leadership at DCF. So just thankful to everybody. And at this point, if you go to the next slide, we can start with our question and answers. And we're going to be monitoring the chat and also the raised hands. Now, Kate Angers, you've had your hand raised from the beginning. So the question is, do you have a question? Go ahead.
I actually don't. I think I hit that button by accident.
Okay, never mind, but that really broke the ice. Okay, so who has questions for us? Okay, Ron Rogers, go ahead.
So can you hear me? I hope.
Yes.
Okay, great. So I think the key role in this is really a big piece that you talked about very briefly, John, is the other key stakeholders. And really, I'm thinking of our judges and and in the counties that have the district attorney's office bring these cases forward in court. Those are the two key players that have to really, there has to be a significant mind shift. An example would illustrate this. The Children's Court Improvement Project did a great training a number of years ago about the importance of permanency, of having the courts review permanency plans more frequently, at least twice a year, every 6 months in court. The judges that attended that initial training bought into that completely. We continue that practice today. But the other underlying message that the clock is ticking on permanency, that it is very important for children to be returned home more quickly, that, from a child age 2 to 4, being in out-of-home care for those 2 years is very significant, more significant than someone who's 50 to aging to 52. The judges that have come behind that group, although they review permanency every 6 months in our courts in Kenosha, that other subtle understanding of the clock is ticking on permanency, that the importance of moving kids home more quickly, they didn't get that training. And we've had judges really not move very quickly in court, really allow many hearings to be delayed and postponed. And that absolutely impacts how quickly kids move home. And we from the child welfare side don't have much influence on that. The judges say, no, we're going to schedule this when we can schedule it. And so there's that training piece, that understanding of the criticalness of this. And I think, so long-winded question. So the reach out to the judiciary is really important. It's more than just a quick training, I think. So that's just food for thought, I guess, or things to think about as you're looking at how we can reach out to that group.
John,
So
do you
what-
want to?
Yeah, so Ron, I can add a couple of contexts too. You're right, though it is more than just a training, and I don't necessarily this is the training as the tools I think that we will develop and work with you guys on. We hope that it's tools that you can use to have an engaged conversation with those stakeholders. So it's not just it's not a formal presentation that you would have with them, but how do you engage them in a conversation about that? And then to your other point, Ron, I think too is one of the things that we're looking to do to start later this summer, and we work with Bridget at CCIP for Wendy and I to go to some of the JET teams and then hopefully expand from there and start having some conversations in those JET teams for people that don't have them in the county. Those are the judicial engagement teams that several counties have. And so start having those conversations and get input from DAs, corp counsels, judges, parent attorneys, GALs in the system, and how do they feel about serving more kids at home or not being part of the process, right? Because if we serve more families at home and we don't do a CHIPS petition, they're not involved in the process. So getting their feedback and concerns and addressing those type of things, I think will be really important for us. So that's another piece that we plan to start. So I look at those as kind of two different approaches. One is really giving you the tools to have those engaged discussions, and then us really starting to get some of that feedback. So as we think about the case practice and the systems and things that we develop, how are we building that voice of the legal community into the changes and things that we're looking at?
So we can go over to the chat for a moment. There was a question about what will be the next steps when the QRT legislation gets passed. So I can just give a quick sketch of that. So once the QRTP legislation gets passed, the next thing we need to do is start working on the emergency rule. And the emergency rule is what will give DCF the ability to create the application process for residential care centers and group homes to start the application process to become a QRTP. So we'll work through that and we will have some stakeholder input there. I think that the important thing here to emphasize is that we are really trying to keep this a pretty tight, streamlined process. We already have an extensive licensing process. And so we're seeing this QRTP certification as sort of on top of that licensing process that we already engage in with our providers. And so we will work to try to get our providers who are ready and poised to do that, who are accredited. Many of them have been working at this for a long time. So we anticipate that there's going to be a large handful of providers that can be accredited pretty quickly. So once we can make that designation, then we will start, communicating with people and letting them know which places are QRTPs. So then at some point there will be a partnership that we'll need with you all, knowing which places are QRTPs and knowing that with the right court process and with the children who actually need that deep end service, who have an assessment that says that that's what they need. If those children are placed in QRTPs, we can get federal reimbursement on those placements. If they're not, we can't. And we have done a lot of math models on this. So just so that you understand, this isn't really a children moving kind of a situation. We're not envisioning that we would be asking people to take a individual child and move them from a non-QRTP to a QRTP. We're looking at partnership going forward. And as we have more of those QRTPs designated, we'll be looking to work with you all to make sure that the kids who are appropriate for that deep end of the system are using those QRTP beds first, assuming that it's the right resource for that child. So it's a really extensive dance. And I think that that brings us back to some of those front end prevention kind of work. Okay, so we've got lots going on here. Should we go to a Q&A and I'll look and see who I think
Yeah,
that
Wendy,
Okay.
why don't I take the first one because I think that's fairly easy. So John asked, can you elaborate on the technology enhancement? Is that SACWIS or additional to it? So I think it is primary SACWIS, and I'll just give a quick update. As you know, we always have challenges in SACWIS because we have a limited budget. And one of the big things that we're working on right now is just improving the infrastructure. So we have a major overhaul of our system going because I think a lot of you realize that it is only accessible on IE, Internet Explorer, as a browser. So we have to move it to a browser neutrality. And once we get that done, and we're really looking to accelerate that timeline, that will allow SACWIS, number one, just to be available on all different devices. So and be supported on an iPad, iPhone, Android phone, those type of things. And then from there, we can start looking at some of the mobile technology and things like that. So that is one of the things that we're really looking at and committed to from a technology perspective. But there is some funding challenges that we continue to have within our SACWA system.
All right, and I'm gonna go to the next question, the next raised hand. So Bill Topol, go ahead.
Okay, Bill Topol, Winnebago County. Can you hear me all right?
We can.
All right. Well, first of all, I want to acknowledge and thank you for what has been decades in the need of basically acknowledging that kids who are taken out of their homes for safety purposes also experience trauma and attachment issues due to us, needing to remove them. And I'm really hearing that today in your presentation, that we really need to acknowledge that there are issues on both ends of, making sure that kids are safe, but also on the other side of things that, we really don't want to remove kids if we don't absolutely need to do that. And thank you for really acknowledging that. And this process, I think, is finally getting us to where we need to be. Secondly, I want to give you some feedback about this notion of giving us tools as directors to try to convince our community partners that they should come around to this way of thinking. And I can think of many circumstances where directors are very much outnumbered by corp councils, by county board members, by police officers, by police chiefs, by sheriffs that basically don't understand this and will not accept it from a director of human services because they don't believe that we have the knowledge base, and we're not credible in some instances. So I will go back to what we did with alternative response. When we rolled out alternative response, for those of you who remember the rollout of that, we basically had community meetings, and experts came in from DCF and from contracted entities to explain this process, to explain this change to our community leaders. And then we as directors had the opportunity to then follow up and talk about why this change is really in the best interest of kids and families. So I'm going to give you a suggestion that you not simply give us tools for us to go and talk to our community partners, but that there be an opportunity that you create for us where you bring in yourselves and maybe whatever foundation to basically do kind of a community event to help us really start the conversation. And hopefully you know what I'm talking about. Those of you who were around during the alternative response rollout, I think it was very successful. I got a lot of buy-in from judges, from the corp councils, from police and sheriffs at that time, because it was a brand new concept of that they needed to wrestle with. And the experts from the outside sometimes have more credibility than we do.
Yeah,
thanks.
so thank you for that, Bill. And I think that, we're trying to stage this out, and we know that this is going to be a marathon, and that in some counties, maybe that initial, having some tools for the directors will be sufficient, and in some counties it won't. And I think we're thinking about this from lots of different angles. So I appreciate that feedback. I think, we've been exploring the idea of making some videos and other things that could be, helping to facilitate some of those local conversations. So I think that feedback is really timely. Thank you. Okay, so where are we at on questions? John, do you have one queued up?
Yeah, so there is a question from Kate from Vilas about how will the state work with northern counties where the service provider network is very sparse and models like home builders are not possible?
So I think that we've been hearing that a lot, and it has been incredibly helpful for those of you who have participated in some of our individual conversations or have met with Secretary Amundsen, with some of us around with you. We have gotten to some of those conversations in rural areas. I see a couple of key pieces to that. One is really having some of those more unrestricted dollars and support. So I think that that's really key for housing, for childcare, some of those pieces. And then the second is that we really need to be able to figure out a way to incentivize some providers to go to parts of the state that they are not in right now. And so there is a rural supplement for some of those prevention dollars that would be in the biennial budget, should it be passed the way that the governor proposed it, specifically for that purpose, to try to incentivize. There are other fields like healthcare where there are actually incentives to try to get agencies to move into rural parts of the states that aren't there, because I just want people to hear that we are not expecting your workers to just start doing more and to now start doing home builders, and then next week they have to start doing home visiting, and that's not at all how we're envisioning this. And I think that that's where the biennial budget ask is so important, because if we have some dollars to work with, then we may be able to partner with a provider to be able to serve counties in a rural part of the state where any individual county may not have enough children, first of all, to support a home builders like program, or also have the funding. So that's kind of what we're thinking right now, is that perhaps the first stage would be some of those more concrete supports. And then depending on what we get in the biennial budget, and we're really feeling very hopeful on that front, but should we get some money, that's going to be a real priority to try to figure some of those pieces out.
All right, let's go to another Q&A, and people feel free to raise your hand too if you want to ask a question. Let's see, let's ask this question again on the prevention, because I think it's relevant. So regarding expenditures for prevention plan services, I'm assuming that rationale for discretionary expenditures need to be documented in the PERM plan of care, correct? Examples: a client's car needs repairs so parent can get to work. Home repair is needed to make home safe for child, catching up on a client's rent, avoiding eviction. Yoga lessons for a parent of autistic child, etc. Are there examples of appropriate prevention expenditures? Are there dollar limits placed on these type of expenditures?
So we are in the process of trying to build out some of the pieces that we'll need to be able to document for the federal government where some of these expenditures went. So when we're talking about the ability to capture the reimbursements, there are going to be some, particularly for the evidence-based practices, I think there's going to be some service level information that we'll need. I'm not sure exactly how much information we will need for those other concrete supports, and that's something that we can take a look at and try to get back to people. So now would be a good time to mention that we do have a website for these town halls. We'll have this recording will be up on the website. We also have some frequently asked questions that we'll put up there. And so we can make sure that we capture that question and find out. So the essence of the question that I'm hearing is a little bit more detail on what might people need to be able to show for the money that they would be spending on some of those other concrete types of supports.
All right, let's go to another question in the chat. Will the screening process be different for families with increased kinship funding? When will the increased kinship funds be available to families? I want to thank you guys for seeing this. I want to thank you guys for seeing this as a need for families that are taking kids in, keeping them out of the foster care system.
So the increased kinship funding, just to be very clear, is not a done deal yet. That's another one of those things that is a proposal in the governor's biennial budget that needs to be adopted by Joint Finance Committee and passed by the legislature. So should that happen, right now, there is actually a pay scale in the statute of how much a kinship care family can get for caring for their child, which is part of where we ran into some challenges with the COVID related dollars, because there wasn't any sort of a way for them to get exceptional payments unlike our foster homes. So there wouldn't be any additional hurdles or anything like that for families to get the additional funding. It would just change their funding, sort of like when we have a change in foster care rate increase and it goes from one amount to the next, it just changes automatically. It would be like that. We've got a question from Mark Ramian. Mark, go ahead. We can't hear you, Mark, if you're trying to talk. All right, well, I don't know what's going on with your audio, Mark, but you can throw the question in the chat if you can. Sorry about that.
All right, so let's go to another Q&A. With 80% of all removals being neglect related, is this good news because many of these situations can be fairly readily resolved, or is it bad news because many of these situations are related to chronic parental issues?
So that's a great question. And we have been really trying to figure some of those pieces out. And I think that this is an area where we will be digging in much more deeply once our lived experience coordinator is on board. So we are hiring somebody who hopefully will have an accepted offer, within the next few days, who will be helping coordinate our feedback from parents and families about what would it have taken to be able to help you to avoid some of the deeper end child welfare involvement. And that's something that I think that we will be able to get from a parent perspective, which will be really helpful. We can get what we can get from the data, and obviously we're really good at doing rich, deep data dives. But I think some of these questions we really need to ask the families who we serve, who are experts on their own situations. And so that's something that that is absolutely on the top of our list to start looking into. I would say that one piece of information that leads me towards this is encouraging, these are solvable problems, is that when we look at the data related to COVID, there were actually 100 less removals that were related to housing during that time period, which would be around the same time period that there was a moratorium on evictions. So, we can't sort of draw any statistical conclusions to that, but I can say that if there are 100 families for whom housing was not the reason that we removed their kids, that really puts me in the area of these are supports. This is the intersection with poverty, and poverty creating instability for families. And this is a solvable problem if we can think about it and resource it in the right way.
All right, let's go to another question in the Q&A. It's related to QRTP. Will there be checks and balances with the QRTPs in relation to actually admitting kids? Will there be a way for counties to share feedback when we have a child that meets a level of need and in-state facilities may not take them?
So that's something that we have been in really deep conversation with providers about, and that I think we need to bring that conversation together with providers and counties. I know that I hear frustrations on both sides of that equation. And ultimately, what we need to do is figure out how are we going to make sure that the children with the greatest need can get their needs met here in Wisconsin, and whether that's a combination of looking at some of these biennial budget proposals that have some additional dollars to be able to serve kids with complex needs, whether that's working with individual providers to create programs for the children who are currently out of state. We're sort of leaving no stone uncovered to try to figure those pieces out. And we'll just, we will continue the dialogue. Obviously, you all hold a big piece of that information. I know that there are some ongoing efforts right now to analyze the children who were out of state, I think in 2019, to really just try to understand what were some of the drivers there. And so there's a possibility you might even get a contact from DCF on one of those older cases to say, can you help us with what was going on there? Why from your perspective was this child not able to be served in Wisconsin? And I think that, if you're able to pick up that phone and give us the information, we can continue to try to figure out what are the subsets of kids who are having a hard time serving in state, and how can we make sure that we have the capability, the competency, the fee structure, all of that stuff to be able to do that work. We also have I sort of mentioned in the presentation, but we're working with the Parade Foundation to really look at the quality of our deep end congregate care work. And so I think that hopefully will also lend itself to this process. But we have certainly heard the frustrations from the county side of sending referrals to lots of places and just getting lots of no's. And I think on the other side of this, if we haven't figured out a way to do better on that end, then we haven't actually made a huge amount of headway. So it's on our radar screen for sure.
All right, another question from the chat. I think it's a clarification question around funding. Perhaps you said this and I missed it, but is there funding outside of the QRTPs related to Families First, and how will that be accessed and used?
So Family First actually doesn't provide any funding. So just to be very, very clear, Family First, what it does is it changes what's federally reimbursable. So right now, any kid who is in out-of-home care is federally reimbursable, nearly, with some very minor exceptions. After October, federal reimbursement for kids who are in congregate care will be limited to kids who are in a QRTP setting, who have the right type of assessed needs, and who have court findings with very specific language. And then it'll be limited for up to 12 months unless there are further approvals. So we will have 14 days worth of claiming for kids who are in any of those deep end congregate care placements. And after those 14 days, if those children are not in QRTPs, we will not be getting federal reimbursement, which doesn't mean that those kids have to physically move. It means that as a system, we need to figure out how to have enough money to run the child welfare system. So I just kind of want to make the distinction between that human implication and the implications for the system. Right now, we don't get federal reimbursement on any sort of evidence-based in-home practices, and that will be something that will be possible in the future, assuming that we have state or local dollars that are funding those services, because you can't get federal reimbursement on federal dollars. So even for the home visiting programs, those would need to be funded with state or local dollars, not with federal dollars, to be able to get reimbursement. So the short is, that's why we have these biennial budget proposals. We are trying to seed some of these different pieces with state dollars so that we would have the opportunity to get federal reimbursement on those dollars. And without those, there is no new money. So Family First will end up being a net loss financially for us unless we can find some other ways to funnel some dollars into the system. The new worker training is another creative way that we're looking to try to get some additional federal reimbursement from the training side. So we're looking at every angle, but that's where we've been really encouraging people, because I think we do have a moment of opportunity with this biennial budget to say, we have a new federal framework. We need to have some state dollars in these specified areas in child welfare. And if we don't, we can't get federal reimbursement. And so I think that that's that moment of opportunity that we're trying not to lose.
All right, we have time for a couple more questions. Mark was able to answer this question in the Q&A, which is again, I think, related to the prevention plan. So is there a time limit on the non-clearinghouse approved interventions in use? What will the fiscal implications be to move ahead of programs that programs that are not approved?
So the programs that are not approved, one, I would say that our prevention plan is sort of a living, breathing document. So we've been told that we can change and add things. So let's say, for example, that we have a bunch of counties that are doing parent supporting parents, and parent supporting parents becomes an evidence-based practice on the clearinghouse. We would be able to revise our prevention plan and say, we're doing this in these 11 counties. And so, we can now get federal reimbursement for it. So we're still waiting to see what will be on that list. In terms of what, there's not really a people have to end practices right now on that in-home side. It's just whether we would get any reimbursement for it. So let's say that your county uses, I don't know. Let's say that they use Safe Care, and Safe Care is not something that's in our prevention plan. Then we wouldn't be able to get federal reimbursement for it. But that doesn't mean that you have to stop doing it. And so it's one of these things we have sort of, there's the human element of what in your locality is the thing that you think is going to help kids and families actually be able to be in home together and be successful. And then there's the math side of it, which is which programs and services can we get reimbursement for? So a great example would be, we met with a county that is doing a similar program to home builders, but it is not home builders to Fidelity because they don't use the clinical workers for that. They use their social workers. And that would not meet the home builders actual, like the program standards for them. And the question for us from that county was, are we going to have to switch to doing home builders the way that they specify it, because we don't think that we have the clinicians in our local area to be able to do that? And the answer, at least for now, is no. I mean, we want you to be able to serve kids and families successfully in home. We are not going to have enough resources to be able to roll out something like home builders to every corner of the state immediately. what we're trying to do is trying to sort of build a community of practice around some of these evidence-based practices, looking first at the places where there are those needs and there's a willingness, and we'll start there. So if you have successful ways right now that you're serving kids in home, I would say continue on with that. Let us learn from you. And we're also going to have to try to figure out the funding side of it. So for example, when we have the new worker training, that'll be a place that we can hopefully grab some more federal dollars. So I hope that's helpful.
All right, Wendy, we have 3 minutes left. So why don't we just do one question and then wrap up? Because I think this.
All right, I'll
question-
stop going so long. Maybe we can get two in
That's-
if I'm
All right,
fast.
so this question I think is more of a comment, but I do think it is relevant because we do know this is a challenge within our western and northern part of the state. Is that we agree completely with the philosophy behind this initiative. The current challenge, however, is that our part of the state is being really hit hard with meth. It will be important to have some resources and approaches that are helpful in serving this population for us to be successful.
Yes.
Yeah, I think that's a great comment, and we realize that. And obviously, yeah, that's not going to be one of the programs that's on the clearinghouse. But what services, AODA services, and other things, I think are important to help serve those families and help you reach those families. All right, we can then do one more question. Let me see. I think we may have answered all of them, actually.
Yeah, I'm not seeing anything that we haven't answered.
Yeah, I think we can. I know people have another Wixop Hack meeting coming up right after this, so we can probably wrap it up, Wendy.
Yeah, I just want to say thank you so much for your time, your attention, your engagement, your partnership, but most importantly, for all the work that you're all doing locally. We know that you're the ones doing the hard work with the families, and we see it. We see the numbers creeping up. We see the creative things that people are doing to serve more kids in their families, with their families, to really tap into relative and kin at every turn, and are just so proud of the work that we're doing as a state. Anything that we can do to help be supportive of you, please reach out. You know where to find John and I. And if you have additional questions afterwards, if you're like, oh man, I forgot to, ask this thing, it's not too late. Just send us a question and we'll get it up on the Q&A. And yeah, thank you all just so much. I really appreciate it.
Thank you, everybody. Have a great weekend.
Yep. Take care.